everyone, this is Mrs. Har. We're starting our second week of Psychology 2, and this week we're going to start off where we're still in the anxiety realm and stress disorders, and we're really going to closely look at the stress response, which I know we have all covered before in our psychology and our science classes, but it's really important we do understand how the body is programmed. It's set with us since back before, back when cavemen were around, and it's the fight or flight response and how our body still does this. If you slam on your brakes because you almost hit a deer or the person in front of you, you're still going to have this a general adaptation syndrome that takes place where your pupils dilate, your hearing sharpens, your saliva decreases, your heart rate increases, your blood pressure increases, your bronchioles dilate, so in case you had to run somewhere quickly. All of these take place, as well as your digestion slows, because it's not, when you're escaping from danger, you're not worried about eating food, and your blood flow to your muscle increases and your muscles tighten. So just think about what it feels like when you get freaked out or you're scared. Think about all the tightening, the things that tighten. It's the things that you need to escape and cope with whatever that danger is. So this is a normal response, and usually it happens, the event leaves, and your emotional, physiological responses dissipate. But occasionally, if it's a very intense situation, this can continue. And you get these physiological responses can cause, of course, health problems. Also, if it's so intense, what you experience, you can have what's considered, we're going to talk about acute stress disorder, and also PTSD, post-traumatic stress disorder. So we're going to look closely at those, and how that looks in the clinical setting when we have a fear exposure, our body's response, our stress response, and perhaps this goes on longer than anticipated and can manifest itself in a psychological disorder. So we're going to be looking at, like I said, the ASD, acute stress disorder, and PTSD, as well as ways to treat this in this first unit. So we're going to look at therapeutic modalities, the different ways that we kind of work with situations such as ASD and PTSD, and one of those is called CBT. I know I'm throwing out all these acronyms at you, but CBT in mental health is used often when we're dealing with things that perhaps medications can't completely cure, and it's intense treatment. It's called cognitive behavioral therapy, so CBT. We're going to talk a little bit about that and what that looks like. So I hope you guys enjoy our unit this week. We have the ASD assignment with 20 points. CBT, remember ASD is acute stress disorder. CBT, cognitive behavioral therapies. PTSD, post-traumatic stress disorder, and our exam. So if you really want to confuse some of your friends, you can start throwing out these acronyms: ASD, CBT, PTSD. They're going to be like, wow, you are in the mental health field, huh? So we're also going to look at, to throw another acronym, the DSM-IV, which is kind of like the textbook of psychology, and how we define disorders. So if you're meeting with a mental health provider and they're trying to determine what's going on with you, they will look at this book called the DSM-IV. It's the Diagnostic Manual. They will look at that to see if you meet certain criteria to qualify to be treated or have the diagnosis of ASD or PTSD. So I know I'm throwing out DSM-V, the ASD, CBT, PTSD. Don't get overwhelmed. I don't expect you guys to memorize these, but just kind of become familiar with them as we cover, and we start off our second week of psychology here looking closer than we did in Psychology 1. We kind of did an overview. Really now we're moving deeper into the clinical manifestations of these disorders and the treatment thereof. So let me know if you have questions and concerns. As always, all questions are great questions, and I'm going to go out with the song Everybody Talks. Mama's always got a back when everybody talks, hey honey, you could be my drug, you could be my new prescription. Too much could be an overdose, all this stress talk make me itchy.